So my name is Justina Munyiva. I'm a field interviewer with the group project. Yes.
I'm Zipporah. I benefit with the group project.
My name is Milka Njerii. I'm a research officer at the African Population and Health Research Center.
Because Zipporah is an amazing lady who was able to benefit from the program. We'll be able to see the change, the impact that the program has had upon her. And it's important for the whole world to know that the group project actually works. Yeah.
Single mothers do not have any support, any kind of support from spouses or from a family to help with the child care activity. So they have to take up the role of taking care of the children and also getting involved in some form of income generating activities to be able to provide for the family. So it's a challenge sometimes for single mothers because they have the responsibility of taking care of their children and the responsibility of making sure that they're also feeding for their families. We worked with 1,200 women in Korogocho, and those were women who had children were 4 years and below, between 1 and 4 years. And the reason why we focused on that age category is because from 5 years and above, the government already caters for or has provisions for daycare facilities for children who are 5 years and above. We approached them to collect their baseline characteristics before the intervention. And then after the baseline survey, they were randomized into intervention and control.
It was good for me from the day they approached up to now. It is just like a daydreaming. My child is going to school, the private one, expensive school. So I think I have done a lot in my life, because at the first time I was living a single room, the small one. It was very squeezed. But after they had taken my daughter to school, I started working. I saved small by small, and I rented a big house. The thing that made me to be surprised that I was asked to choose for myself the school, the preschool that I want my daughter to enter. And I suggest Rehema Daycare and Orphan Center. It is near here. I was very happy because that school is very expensive. So I was very happy, yeah. After I have got this sponsor, I get many opportunities for going to look for a job and to work. Because before I was just staying with my child there waiting for something, because you can't go for a work with carrying your baby at your back. It is very hard. Someone cannot give even the work. You have to stay just like that. But after that I get more morale to work. Yeah, so I used to make people's hair neat at the salon. Sometimes I wash for the people clothes, wash the dishes. Yeah, so I think it was good for me, and I had benefit a lot. The benefits are still there because now I'm working. I've never been scared about my child, because before I used to leave my child anywhere outside. The vehicle can hit him, she can get any accident. But for now, from that day, I'm never been scaring, because my child is at school all the time. Yeah.
So the main findings from this study is that one of the things that we found is that mothers who are in the intervention, or more mothers in the intervention, participated in some form of income generating activity. So we had more mothers, about 88% more mothers in the intervention participating in some form of income generating activity in the course of the project period, compared to those who were in the control. And what we found out is that if mothers are provided with subsidized childcare services for that age category, they're able to participate more in the labor force. So we have in Kenya, we have more men being involved in income generating activities, or we have more men in the labor force compared to women. And to be able to close that gender gap in terms of participation in the labor force, I think it would be important, from what we have found out in our research, to be able to provide daycare services or daycare support for mothers who have children 4 years and below, so that they're able to also participate in the labor force. And our research showed that meant to provide or to come up with policies that provide for conducive working environments for mothers who have children, and also to provide entrepreneurial and entrepreneurial training, skills training for mothers or for women, so that even as we provide the daycare services, they also have that kind of skill that takes them to the next level of now being able to look for work or being engaged in some income-generating activities.
I'll say that I'm hoping that the government will be able to realize that subsidizing daycare centers is important, and it will be put in the law, they will pass it on, that it will be at the ward level, that every MCA will be able to access and have at least a subsidized daycare center in every ward. For a starter, that would be important.